I was born and raised in Colorado, so I lived in Denver, and then we moved and I spent middle school and high school in southern Utah, so we were St. George. And then after that, we moved to Nevada, so I spent time there. I went to BYU for undergrad, and then for medical schools at the University of Nevada. Got to have some really good experiences, both in rural medicine, but also in major trauma, because we would work at the trauma center in Las Vegas. And then I went to Baylor University Medical Center in Dallas for residency in orthopedic surgery, and spent 5 years there. And again, got a lot of really good trauma experience being in Dallas. We got to work at Cook Children's Medical Center, and then got to do a sports medicine fellowship at Ohio State. And then now I get to be here. So married, my wife's name is Laurel, just like the city. She still tells me that I say it wrong, but I'm gonna figure it out eventually. And then we have 3 kids. So James is 7, Daniel is 4, and Adelaide is 1.5. We knew we wanted to be somewhere in the West. We knew we wanted to be somewhere that was a little smaller community than some of the places we had lived. And we really just tried to find a place that would be a great fit for our family and where the job would be great. And so we came out and quite honestly just felt like home. The people that we met everywhere we went were so friendly, and the people in the clinic and the people on staff were on top of things, and it was a very good fit for us, both personally and professionally. So I chose to go into orthopedics because it was a place in medicine that I felt like I could really help people. I felt like I could see the progress that people made. Orthopedics is something where someone comes in and I can see a defined injury and I can help them work through that and get them back to what they want to be doing. And I find that very rewarding. One of the benefits of Ortho Montana is that we're a subspecialized group. So what that means is that each individual surgeon has a specific subspecialty within orthopedics that they take care of. So for me, that's sports medicine. And one of the things that's really important about that is it allows for a greater depth of understanding of the issues that are specific to a certain patient population. And because of that, you can tailor their care in a way that you may not be able to if you were seeing, everything that came through the door. After a patient comes in and sees me, I want them to be able to go home and be able to tell their family and tell their friends that it was a good experience, that they were listened to, that their concerns were addressed, and that we came up with a plan to help them move forward so that they can get through the difficulty and the injury that they have. You have somebody that comes in and they're in pain and they're miserable, and they can leave by the time you kind of get them through their treatment. They can be back to a functional level, and to be able to see people get back to that is really rewarding.